Morning. Good morning, all. This mask out of the way. I want to start this morning with just talking about some good news before we get to less good news. Try and arrive not too early, not too late. I would stress get there half an hour, but no earlier, but don't get there any later either, or you might miss your booking. I also just want to stress that where we go in this situation is in the hands of the community. Vaccination is our freedom path. It could be a big day out for the food providers of Sydney. Jump on the Service New South Wales, or actually jump on nsw.gov.au. That'd make it easy. nsw.gov.au this afternoon. They're just putting that connection up there for you. So sometime this afternoon, maybe after about 2 or 3, hop on that web address and you'll be able to make a booking. How we get out of this rather troubled time. I also just want to say that on that theme of people having it in their own hands, I think it's time that is absolutely not what you're supposed to be doing. It's a pretty simple rule. Stay at home. Don't go out. Unless you need to go out, don't go out. Pretty simple message. Now, but the not so good news. To 8 p.m. last night, we had 319 locally acquired cases. 319. But 194 are still under investigation. That's why I'm saying to the community, you've really got to get serious about staying at home. I'll leave it to Dr. McAnulty, if that's all right, to let us know about how many people are in hospital, how many people are in intensive care. I believe probably Armidale LGA will have to be put into a lockdown. If I were living in that area, I would be actually not going out of my house today. I would be staying at home. I wouldn't be visiting friends, and I'd be making sure that I protect myself and my family. Of course, it will be the same arrangements as applies in the Newcastle area, which is effectively the Greater Sydney lockdown area. And on that note, I think I've covered. I might leave it to Dr. McAnulty to cover the unfortunateness. There have been some more deaths, sadly, and I think Dr. McAnulty can talk about those. But I just want to say to each of the families, I can't imagine how you're feeling, but my condolences and the government's condolences to each and every one of you on the passing of your family members who've been caught up in this terrible COVID situation. Dr. McAnulty. The rules can be the rules, but if people don't comply, then obviously the community will continue to suffer. I did see Paul Kelly's comments. He hasn't told us what that circuit breaker would be. I just heard what you thought it was, but I haven't heard that. And I checked with my own Chief Health Officer this morning, and she hasn't heard that either. The circuit breaker in New South Wales and in Sydney is for people to comply with the rules. Pretty simple. Just stay at home. That's the circuit breaker. It's a pretty simple rule. Stay at home. Don't go out. I remain surprised that even in my local area, when I wander around and people stop me and talk to me, that they're telling me they're not vaccinated. Well, go and get vaccinated. That's the name of the game.
A plan to bus Year 12 students?
Oh, bus.
Yes, that's okay. From regions of Western Sydney into that Kudos hub has been scrapped. Was that due to concerns about transmission on the buses?
Well, look, education did their bit. They tried hard to work with health on the buses, but there was, let's just say, the staff apparently were not that keen to be supervising the education staff. This is your opportunity to get a little bit of gold. No, look, I still harbour the hope that we'll get back to zero. It's almost a level of self-entitlement to think that you don't have to have the vaccine, but your neighbours do. Well, no, you all do. We all do. Every one of us. People are well, it's just plain stupid. Not so good. Positive. Yes to your first question is the apparent situation. and quite possibly to the second. I think there's general compliance. Dip their finger. Thank you, everybody. Can I just say, thank you.